Under the topic of health promotion and health communication, there are four major titles that you need to cover. Number one, health promotion. Number two, health education. Number three, health communication. And number four, health education program. Health promotion refers to the improvement of your health. Health education refers to the ways of imparting knowledge about health. Health communication refers to the ways of exchanging ideas, feelings, and opinions about health, either in one direction or in both direction. And health education program refers to programs that allow you to exchange those ideas. So, again, what are the four major topics to be covered? Number one, the improvement of health or health promotion. Number two, process of gaining knowledge about health or health education. Number three, communicating or exchanging ideas about health or health communication. And number four, programs that help you impart knowledge about health or health education program. Again, health promotion, health education, health communication, and health education program. First, let's look at health promotion. What is health? Health is your physical, mental, and social well being, and not merely an absence of disease or infirmity. What is promotion? Promotion refers to improvement. So, health promotion is the improvement of your health or the improvement of your physical, mental, and social well being. By definition, health promotion refers to the process which enables people to increase control and quality of their own health. What does this mean? Let's say, for example, there's a man who used to smoke before, but now he has stopped smoking. Once he stops smoking, this decreases the probability of him getting lung cancer, and this in turn increases his health status. So, this right here is an example of health promotion. The person took control over his own health. He took control over the quality of his own health, over the process of improving the quality of his own health. So there are certain steps that you can take in order to increase control over the quality of your health. Okay. There are various factors that influence your health, and these are called determinants of health. For example, income. Let's say you are financially stable, you are able to pay for good food, pay for doctor visits, pay for timely checkups. Whenever you suffer from a disease, you can go visit a hospital and get an appointment easily. This in turn increases your health status, and by doing all these activities, you're promoting your own health. But then let's say you are quite poor, you can't afford for good checkup, you can't even afford for good food. This in turn degrades your health, and you are unable to promote your health. Similarly, education. A person who has received proper education has enough knowledge about ways to improve and promote their own health. Similarly, environmental factor. Let's say you stay in a city which has high levels of air pollution. Obviously, the pollution is going to affect your lungs, degrade your health, and basically harm you or stop you from promoting your own health. So these various determinants, when they change, they bring change in your health as well. So changes in determinants of health change your health. Either they improve your health or degrade your health. For example, let's say the city you are staying in has fresh and clean air. This in turn results in healthier lungs. But then let's say the city that you are staying in has polluted air. This in turn degrades the health of your lung. So this is how the various determinants of health determine your health. Okay. Over time, the concept of health has changed. So previously there was your old concept that has now changed into new concept. These are the various concepts that have changed over time. First, People used to focus more on prevention of disease, how you can prevent the occurrence of various disease. But now this concept has changed into promotion of health, how you can make yourself better in terms of health, how you can increase the status of your own health by yourself. Second, you can change your health status by changing individual behavior. For example, if you start exercising daily, obviously you are going to improve your health. But now the concept is that change in social environment will change your health. That is, if as a community, programs such as community runs are organized or community marathons are organized, this will promote everyone in the society to take part in the run. This in turn will improve the health of the community. And by improving the health of the community, there will be motivation and encouragement among individual members of the community to improve the health of one another. So, in old concept, an individual was targeted. In new concept, the whole community is being targeted. Then, old concept promoted community participation. New concept promotes community involvement as well as self reliance. For example, as per old concept, let's say a governmental organization organizes community, let's say tree plantation in an area, and the people of the community are invited to plant trees in their area, which in turn improves their environment and their own health as well. As per self reliance, the people in their community, they themselves decide what to do. They themselves organize a program of planting trees and then invite other people from their own community to plant trees as well. So the concept changed from prevention of disease to promotion of health, change in individual behavior to change in social environment, community participation to community involvement, as well as self reliance. Over time, different conferences have been held in order to promote health. The first ever conference was held in Ottawa, Canada. The second was held in Adelaide, Australia. The third was held in Suns Valley, Sweden. The fourth was held in Jakarta, Indonesia. Fifth was held in Mexico City, Mexico. And the sixth was held in Bangkok, Thailand. Out of all these conferences, you need to know about two of them, the first conference and the fourth conference. The reason these two conferences are important is because of their output. The first conference gave us the Ottawa Charter, and the fourth conference gave us the Jakarta Declaration. And you need to know about both Ottawa Charter and Jakarta Declaration. First, let's look at the Ottawa Charter. This right here is the logo of Ottawa Charter. The Ottawa Charter contains 3 strategies and 5 action areas. The 3 strategies are written within the circle of the logo, and the 5 action areas are written within the wings surrounding the circle of the logo. We need to remember all 3 strategies and all 5 action areas along with their meanings and examples. First, let's look at the 3 strategies that are mentioned under Ottawa Charter, and they are written right here within this circle. So we have advocate, mediate, and enable, or AME, AME, AME. So advocate. Advocate refers to the process of coming up with plans, recommending plans. So this is the process of formulation of plans. Mediate refers to the process of facilitation of those plans. And then enable refers to the implementation of the plan. Implementation of plan. So for promoting health, the first process would be to come up with plans, that is advocate, then facilitate those plans, that's mediate, and finally implement those plans, that's enable. For example, let's say you went to an area where the major health problem is gastritis. Now you want to provide awareness about gastritis in that particular area. So you first formulate plans about providing awareness, that's advocate. Then you probably reach out to organizations for what? For probably your sponsors. That's facilitation. So organizations and companies, they facilitate your plans either financially or by providing other resources. And finally, you organize awareness program within that area where gastritis is prevalent. That's enable or implementation. Again, what do we have? We have A, M, E. A for advocate, M for mediate, E for enable. Advocate means coming up with plans, mediate means facilitation of plans, and enable means implementation of plans. A, M, E. Now, within the wings, you have action areas, and there are altogether 5 action areas. The first is strengthen community action. For example, community charity marathon. Let's say in a community, a marathon is held in order to collect charity for a good cause, and multiple people, they take part in this marathon. What is happening? Number one, the people taking part in the marathon by running are promoting their own health. And number two, the money collected from the marathon is being used for a good cause. So, this is what we call strengthening community action. The community itself is taking actions on their own in order to promote the health of the community itself. Other examples are community kitchen. Community kitchen, basically multiple people from the community, they come together, cook together, feed one another, or they could even cook food in large amount and distribute it to the poor people within the community. Similarly, other community programs like vaccination programs or maybe fundraising, all these community actions help promote the health of the community itself. Then, develop personal skills. For example, online education on losing weight. So people can gain education on ways to lose weight through online methods. This way, they can develop their personal skills and they can finally improve their own health through the development of their own personal skills. So they'll first learn about exercises that will allow them to lose weight. They will perform those exercises, lose weight, and promote their health. create supporting Create supportive environments. For example, establishing vegetable markets. Let me give you more examples of developed personal skills. So classes on diabetes. So this way you can gain knowledge about diabetes, improve your skills about diabetes. Okay, create supportive environment, establishing vegetable markets. So as a community, you can hire people or maybe employ people to directly supply vegetables from organic source. This way, the people of the community has a chance to get good healthy vegetables which will promote their health. Similarly, there's your partnering with dairy farmers. The community people can partner with dairy farmers for a healthy supply of dairy products, or formation of bike lanes. So the formation of bike lanes will avoid the occurrence of accidents and it is much more safer for bike riders. Workplace wellness. Workplace wellness, basically promoting the use of safety measures while working in dangerous areas. So these are the various ways a supportive environment is created for the individuals living in the community. And then there's your reorient health services. So health services should not just be limited to preventive or treatment wise. It should also be focusing on promotion of health. So it should also be promoting. Or other example can be screening, health education, awareness program, programs that encourage people to stop smoking. Finally, they should build healthy policy. Basically, policies that encourage the promotion of health. For example, speed limit laws. So, if you formulate laws that allow the limitation of speed in a particular lane, this will decrease the prevalence of accident. Similarly, smoking restrictions. So, at places you can restrict the process of smoking, and this will decrease the habit or the prevalence of smoking among the people of the community. Next, we have Jakarta Declaration. The Jakarta Declaration was the output of Conference for Health Promotion, the fourth Conference for Health Promotion, which was held in Jakarta, Indonesia. So we have the Jakarta Declaration. So the outline of declaration, basically, in a brief, the declaration mentioned the three major points. First, health promotion is a key investment. What does this mean? There's a person who used to smoke, but now that he has been given awareness about the harmful effect of smoking, he stops smoking. So the person stops smoking. Once the person stops smoking, there's less probability of lung cancer occurring in the person, higher health status, and higher life expectancy. So by not smoking right now, the person is adding the number of years in his total life. So this way the person is promoting his own health by investing in his health. That is why health promotion is a key investment. Health promotion makes a difference. By not smoking, the person is reducing the chance of lung cancer in himself. So obviously, health promotion makes a difference. It makes difference within the health of the individual as well as the health of the community as a whole. Poverty is the greatest threat to health because when people are poor, they can't afford good food, good education, a proper place to stay, and a hygienic environment for themselves. And these situations, they create a bad environment or an unhealthy environment for the person to stay in. So this is the outline of the declaration. The declaration set priorities for health promotion, and there are altogether 1, 2, 3, 4, 5 priorities that has been set by the Jakarta Declaration. Priority number 1: promote social responsibility for health, public and private sector. Basically, the public and private sector should also be responsible for the promotion of health. For example, let's say at restaurants, if people put no smoking zone, obviously the people, they are not gonna smoke. As a result, the person is not gonna get smoke within himself, and there's not gonna be passive smoking as well. Similarly, let's say the school in the community from a young age teaches students to follow healthy hygienic behavior. This is going to promote their health. So the public and private sector can also be responsible for the promotion of health. Increase investment for health development. In terms of finance as well, investment must be there in order to increase or improve health of the people. Like, more trees can be planted by investing more on tree plantation, more screenings can be done by investing on screenings, more health checkups can be done, more immunization programs can be done, more data can be collected to check for the health status of the people. Consolidate and expand partnership for health. Basically, take sponsorships from organization or increase the area of improvement of health by partnering with multiple organizations, NGOs and INGOs. Increase community capacity and empower individual. Even the individuals living within the community should be empowered to perform, empowered to improve his or her own health as well as conduct programs that will result in the health promotion of all the people in the community. Basically, there's a community, there are few people in the community, they together plan to organize marathon. This way the people in the community can stay healthy. So that is how individuals should be empowered to take initiative as well, and then secure an infrastructure for health promotion. So these were the priorities. Out of all these, the important stuff that you need to know from examination point of view is number one, the definition of health promotion. So health promotion is a process which enables a person to increase control over their own health and quality of their own health. So a person takes initiatives, these initiatives allows him to increase the quality of his or own health. This is what you called health promotion. And the second important stuff is the Ottawa Charter. You need to remember all three strategies and the five action areas of Ottawa Charter. The AME, or the advocate, mediate, and enable of the Ottawa Charter. Advocate means making plans, mediate means facilitating plans, and enable means implementing plans. AEM results in what? AEM results in health equity. Health equity means everyone in the community has equal chance of improving their health. That is what health equity means, and that's the final result of AME. Then there are your five action areas. Strengthen community action, like community charity runs your community kitchen. Develop personal skill, like proper ways of washing your hand with soap and water. Online education on losing weight, classes on diabetes. Create supportive environment, like establishing vegetable market within the community that supplies organic vegetable. Making laws, or making your workplace laws in order to make workplace more safe and secure. Making bike lanes for the safety of people who ride bikes. Then there's your reorientation of health services. Health services should not just be focusing on your prevention and treatment of diseases. It should also be focusing on promotion of health through health education, awareness programs that encourage people to stop smoking. And finally, build healthy public policy, such policies that help improve health of people, like smoking restrictions and speed limit laws.